Why Germany needs private health insurance. We currently have a hybrid system. You can be in the public health insurance or enforced health insurance, and you can be in the private one. There are regulations that you can only become part of the private one if you're above a certain limit, if you're an entrepreneur or something else. Private insurance is actually making sure that our health system works at all, because if everybody would just actually utilize the enforced or public health system, that would not be good enough. Most doctors' offices would have to be closed because they can't afford operating without having private patients as well, which pay not only double, 3 times, sometimes up to 10, 20 times as much for the same treatment as the public health insured. Hospitals would not be able to attract specialized doctors. New treatments would not be tested or actually executed anymore, because that is currently, when you look at what the public health insurance is allowed to operate in, is many of these items would not have been there if they wouldn't have been treated in private health insurance for a long period. Many experts, which you rely on even as a public health recipient, is many of these highly specialized doctors would not even be in Germany or would not even be practicing at these hospitals if we wouldn't have the mixed systems. You can actually risk that you get into a system like what you have in the UK, where you have NHS, or look at Canada or anything else. In many of these countries, these complete state-controlled health systems have failed. So, Mr. Scholz, don't touch private health insurance if you don't want to make our health and insurance system, which is already broken in the first place, even more broken. Make sure that you keep private health insurance in place as it is, because if not, you will lose a lot of not only highly specialized doctors, you will actually force more people into a private health treatment, which is completely privately paid, which will then no longer be accessible in any way to the public sector at all. So this is a high-risk discussion. Stop touching it.